Hello, my name is Emily Cahue. I am an occupational therapy student at the University of Texas Rio Grande Valley, and today I will be going over my presentation, which is titled Telehealth, the Journey Forward Beyond COVID-19. So a little bit about me. I am an occupational therapy doctorate student at the University of Texas Rio Grande Valley, and I obtained a bachelor's degree in exercise science with a concentration in occupational therapy at the University of Texas Rio Grande Valley. Prior to entering the occupational therapy program, I did work as a 6th through 8th grade tutor, where I was later reassigned to work as a 3rd grade tutor at the Rio Grande ISD. My role as a tutor was to provide educational assistance and technological assistance to students who were receiving both on-campus and off-campus services through distant learning. So during this work experience, I did witness several difficulties and advantages that were present when using technology as a primary source of service. Objectives for this presentation include equipment considerations, tools, and the educational value of this presentation is that it's going to provide the opportunity for occupational therapists to learn valuable considerations when utilizing contemporary modalities such as telehealth for occupational therapy interventions and evaluations. And as mentioned, equipment considerations will be later discussed, as well as tools that are needed for telehealth interventions. So by the end of this presentation, viewers will be able to identify one consideration when selecting equipment going to their first telehealth session, and viewers will also identify one tool that can be used for telehealth intervention. The next slide that I have here is my abstract slide. So to begin with my abstract, I'm going to begin with the definition of telehealth by AOTA, and that is the application of evaluative, consultative, preventative, and therapeutic services delivered through information and communication technology. Telehealth is a service delivery method that can provide greater access to limited services, with several studies even reporting positive perceptions on telehealth in the service delivery of pediatric populations. In a study conducted by Little et al., it was found that occupation-based coaching delivered via telehealth provided successful educational outcomes for children with autism. The COVID-19 global pandemic became a time of exploration for methods that could provide rehabilitative and therapy services while being in a lockdown. So with the change of service delivery from in-person to telehealth, important considerations and factors were necessary when implementing telehealth. So this presentation will provide resources on telehealth utilization in pediatric populations, and will also provide factors that may cause a barrier to the implementation of services through telehealth and how to overcome those factors. So the next slide I have is basically discussing what telehealth is. So just to redefine what AOTA has, is the application in which occupational therapists can evaluate, consult, and provide preventative and therapeutic services through information and communication technology. So during the COVID-19 pandemic, both educational and work settings transitioned from in-person interactions to virtual and technological interactions. So this transition marked a new era of telehealth for therapists and clinicians in so many settings. And although telehealth had been around for quite a while, the recent rise of telehealth in healthcare practices occurred mainly due to the COVID-19 pandemic. This promotion of telehealth usage in occupational therapy had previously been researched but had very limited studies done. Attitudes and perspectives towards telehealth had been, for the most part, positive, meaning research suggests that therapy services delivered via telehealth can be effective when delivering to selective populations. So what does this literature say about telehealth and occupational therapy? So several studies have been conducted as previously mentioned. However, in the few that were found prior, such as the CRIS 2013, the study was conducted on children from the grades of 1st to 6th grade who displayed deficits in visual and fine motor skills. Skill-based telehealth sessions were found to have improved skills in children who had handwriting deficits. In a study conducted by Rodovert and Jacobs, the perspectives of occupational therapy clinicians were gathered through the method of online surveys. Some benefits listed in the study were that telehealth provides important support for homebound students and may also increase collaboration with parents and teachers. The main barriers were technical issues, which include connectivity and computer issues, lack of physical contact, and student factors such as lack of performance skills that are required when using technology equipment. More recent studies include a study conducted by Hermes et al. In 2021, which included the perspectives of school-based clinicians, and they were gathered using telehealth in a rural state. So the results of the surveys conducted in the research displayed that prior to the COVID-19 pandemic, many school districts were not utilizing telehealth. In this study, the main barriers faced dealt with training, so the programs required for telehealth services, technology needs, computers, Wi-Fi, iPad, and keyboards, and concerns with the quality of services. In a study conducted by Cahue et al., approximately 80% of clinician participants reported that the virtual environment negatively impacted the level of engagement with child clients in comparison to in-person sessions. So, we all know that telehealth is due to the pandemic and knowledge acquired in school. However, as entry-level practitioners, there's a difference between what we need to know and what we already do know. So, what we need to do if telehealth is expected in our first work experience goes beyond what we're taught in school. So for that reason, I am going to include several equipment considerations and equipment tools, and my current level of knowledge of telehealth goes beyond this presentation, as I currently have several ongoing research studies that are specifically revolving around telehealth. And to begin, so equipment considerations that I am going to be talking about are supervision, assessments, activities that will be administered, environment, client privacy, accessibility, and affordability. So when deciding on equipment to be used during telehealth, several components, such as the ones I just mentioned, should be taken into consideration. So to begin with, supervision. What type of supervision is needed? Do parents and caregivers need to be involved? If so, are they aware? Assessments and activities that will be administered is also important to take into consideration, such as how difficult are they to be performed? Can they be administered through telehealth? Will the parent or caregiver need to assist? The environment. How is the session area set up? Does the client have the required space or activity or the materials to complete the activity and assessment? Client privacy. So how will you be able to maintain client privacy? How will you keep their session confidential? Accessibility and affordability. Does the client have access to required materials? Are they able to afford the required materials? So to give a brief demonstration of what accessibility and affordability means, I have brought out a couple of tools that you can find in the kitchen. So two forks. So two common forks, they can either be steel or plastic. These are plastic, and a rubber band. So when creating treatment activities or when conducting anything through telehealth, it's very important that you take into consideration, does the client have accessibility to it? Are you asking them to go and buy a specific game? Are you asking them to incorporate a specific object that can't be found at the home? So where these can be found at the home, a rubber band and forks, this is very easy accessibility and very affordable. So what I'm going to do here is I'm going to show you how you can go ahead and do this to work on grasping. You're going to go around, make it real tight on the top of the fork. So as you can see here, now you're able to work on fine motor skills such as grasping, all within accessibility and affordability of two forks and a rubber band. So when I mention accessibility and affordability, it is very important that you do take into consideration what the client is able to have, especially on a very short notice. If they're not told in advance that you need to have this, and this, make sure that you do come up with treatment activities that can be that are very accessible, that can be obtained within the kitchen, within the restroom, within the bedroom. So for, again, the forks, easily obtainable. You can go into the kitchen, get the two forks and the rubber band as well. Easy, and it can be used. So needed tools. Technology needs were reported as a major barrier faced when using telehealth. So it is important to know what technological tools will be needed prior to a telehealth session. So tools include, but are not limited to, computers and laptops, iPads, speaking devices, especially if an individual uses an AAC device, mouses, which is also your keypad, and then keyboards, specific apps or programs that are required for your specific session, and Wi-Fi. Wi-Fi is a big issue that was noted. Based on my work experience, we had difficulties connecting students through Wi-Fi, and that is an issue that can be faced in the future when working with telehealth sessions. So that is very important to know if it is needed, and if so, how can it be obtained? Does the client already have it, or do you need to provide it? Also, specific tools needed for assessments and treatment. As mentioned before, it is a consideration you need to take when doing treatment sessions through telehealth. So just a quick tip. So for more tools and equipment resources, you can go online and search up occupational therapy telehealth guides. You can also search up for equipment requirements. You can also search up for equipment considerations. Basically, anything that can help you with telehealth services to provide the best and the most effective telehealth services. And as mentioned, I was going to be presenting resources. So my references, I did not use all the references that are cited in this particular presentation. However, these are being used for a future research on telehealth. Therefore, I am including them due to the knowledge that I gained from them, as well as for providing resources on telehealth interventions, tools, and evidence-based practice. So these references are all based around telehealth and occupational therapy. And that is all I have. So thank you so much for watching my presentation. For any questions or for the request of the references, please contact emily.gawe01@utrgv.edu. Again, emily.gawe01@utrgv.edu. Thank you so much, and I hope you all have a great day.